Strawberry tongue in scarlet fever. Scarlet fever can cause a strawberry tongue, which is a red, bumpy tongue. This symptom, along with a characteristic rash and sore throat, is a hallmark of scarlet fever, a bacterial infection caused by Streptococcus pyogenes. Let's discuss it in detail. What is scarlet fever? Scarlet fever is a bacterial infection, typically following a strep throat or skin infection, caused by Streptococcus pyogenes. It's characterized by a distinctive red, bumpy rash that feels like sandpaper, along with a sore throat and fever. What is strawberry tongue? A strawberry tongue is a specific symptom of scarlet fever, where the tongue appears red and bumpy, resembling a strawberry. Early in the illness, the tongue may have a white coating, which then peels away, revealing the red, bumpy surface. What causes strawberry tongue? In scarlet fever, the tongue's strawberry appearance is caused by a bacterial infection called strep throat, specifically by the release of toxins by the Streptococcus bacteria. These toxins lead to inflammation and changes in the tongue's surface, causing it to appear red and bumpy, resembling a strawberry. What causes the bumps in tongue? The tiny thread-like projections on the tongue, papillae, shed or slough off, and the remaining mushroom-shaped projections give the tongue its bumpy, strawberry appearance. Other diseases having strawberry tongue. Strawberry tongue, a condition where the tongue appears red and bumpy like a strawberry, is most commonly associated with scarlet fever, Kawasaki disease, and toxic shock syndrome. It can also be a symptom of other conditions like vitamin B12 deficiency, certain infections, and, rarely, even yellow fever.